Hello, good morning to everyone. So today, just to last time I did not cover the muscles diagram. So that I wanted to just to revise you and complete the total pharynx. So as you have come across the muscles of the pharynx and all, very important 2 marks question is asked about the pharynx is what are the parts of the name the parts of the pharynx. So you should know the 3 parts: nasopharynx, oropharynx, and laryngopharynx. So you should know the almost all these 3 parts. Next comes as a important one, which is you have to remember about the what are the parts which is you are going to see in the introduction. So clinically, it is a part of the upper respiratory passage. You have to know, and in that you have to remember about the total pharynx. So in this you have to know upper part it transmit air and lower part is food and middle part is air and food one at a time. And the length of the pharynx you have to remember. So next comes about the most important part which is you have to remember. I have told the last time preliminary remarks of the that is the pharyngeal muscles. Here, almost all the preliminary remarks, the whatever the muscles of the pharynx we called as they are the constrictor muscle. So you have to remember about the constrictor muscles here. Almost all these are 3 pairs of constrictor muscle: superior, inferior, middle, and inferior. So remember here, the pharynx consists of the we have the 3 pairs of constrictor muscles. In this, you have to know about the total, which is you have to remember about the that is the almost all the muscles of the pharynx we call as a constrictor muscle. That you have to remember. So in the pharynx, you have to mention the all these 3 types of muscle which are arising, originating from the posterior to the posterior opening. That is, we are going to have the posterior opening of the nose, mouth, and larynx. There, anterior to that, there is an origin you get. Means what? Posterior part of the nose, oral cavity, and larynx. There is an origin of these muscles starts. So they are originates from the anterior part of the, we are going to get posterior opening of the nose, oral cavity, and larynx. So that is origins you are going to get. And almost all fibers, they are both are traveled posteriorly. And I have told the one mentioned the word that is a median raphe. So here you have to remember about the median raphe. Both the right and left, they come and join with the median raphe that you have to take part. Here, this is a insertion point of the pharyngeal muscle. So this is all about you have to know about the insertion point of the pharynx. So first preliminary remarks, I have told the almost all the muscles of the pharynx we call as an superior, middle, and inferior constrictor muscle, and they are so arranged that is the inferior overlaps middle, middle overlaps the superior. Means what? This muscle inferior overlaps middle, middle overlaps the superior. So next I have told the origin point of this, they are present anterior to the posterior opening of the nose, mouth, and larynx. So that is. Then these fibers of the origin fibers muscle, which is going laterally and posteriorly and inserted at the median raphe, that is we call. So this is all about the preliminary and lower end of the edge of the inferior. This is the inferior constrictor muscle, lower edge, which is continues as a esophagus that you have to know. So my dear students, I hope that you have to know these all are the preliminary remarks of the that is the pharyngeal muscle. Last time I have told. So next point you have to remember these are the part which is a styloid process. You can see this is attached to the styloid process. We have the styloid ligament. Stylopharyngeus we are going to have here, and this is a median raphe, that is the insertion point. So now you have to remember about the this basis sphenoid pharyngeal tubercle. This is And we are going to get pharyngobasilar fascia, superior constrictor, middle constrictor. Inferior constrictor is of two types, thyropharyngeus and cricopharyngeus. That is you have to know in this. So this is all remember about the you have to during the that is the origin insertion of the that is the pharyngeal muscle. So in this you have to know the origin of the superior constrictor muscle. It originates from the pterygoid humulus, pterygomandibular raphe, medial surface of the mandible and posterior end of the mylohyoid line, side of the posterior part of the tongue. Means what? Mandible and tongue superiorly at the level of mandible and tongue. This is comes so that these all muscle fibers superior constrictor arising from the this part. So pterygomandibular humulus, pterygomandibular raphe, pterygoid humulus, pterygomandibular raphe, medial surface of the mandible and posterior end of the myloid line and side of the posterior part of the tongue. This is the origin point of the superior constrictor. Middle constrictor, lower part of the styloid ligament, lesser cornea of hyoid bone, upper part of the greater cornea of the hyoid bone. This is you have to know. So hyoid bone I have shown in the body. Here you can remember below the mandible, prominent projection, that is the hyoid bone. Inferior constrictor, it is divided into thyropharyngeus, cricopharyngeus. Thyropharyngeus arises from the thyroid cartilage, cricopharyngeus arises from the cricoid cartilage. So thyroid and cricoid, thyroid cartilage, cricoid cartilage, that is the origin point of the inferior constrictor muscle. Insertion, all the constrictors of the pharynx are inserted into the median raphe. I have told the median raphe, how it is attached here in the midline and both the fibers joining, meeting in the midline. That is we call as a median raphe. That is all about the insertion point of the constrictor muscle. So almost all after this, you have to study about the now about the that is a after the blood supply and all nerve supply you have to remember, and then lastly going to the that is the one point which is about the clinical anatomy. Very important nowadays you have the coronavirus infection. Whatever the coronavirus infection which is enters through the nose, which is from the nose nasal through and the nasopharynx. It remains first 3 to 4 days in the nasopharynx. Here you will take means care, you will be not going to extend the infection. It is affecting the first at the nose and nasopharynx, then it is going to the throat region, that is at the laryngopharyngeal region. That laryngopharyngeal region you cannot control, then it goes through the trachea and enters into the lung. So, my dear students, very important to understand how the coronavirus enters into our body. One of the route which is entering droplet through the any person which is coughing in front of you who is affected from the coronavirus, that virus is first enters through the nose or any which is fomites or any material touched by the corona positive patient, that is you have taken handled and you have washed or you have touched your nose, and through the nose that virus enters first into the nasopharynx, nose nasopharynx, then it is going to the throat region, that is about the laryngopharynx. So that is a condition which is you can call that is a pharyngitis or upper respiratory infection, upper respiratory passage infection. So upper respiratory tract infection we can call URT, that is the upper respiratory tract infection. So my dear students, your mechanism of coronavirus entering into the body and affecting, and first 3 days it is 3 to 4 days it is in the nose or nasopharynx, then next 4 to 9 days it may enters into the throat, and afterwards in the 7th to 12th or 7th to 10th days it may go to the lung, and you may have the severe complaint on the affection after the 9th to 14th day. So it is very important, as soon as you come in contact today with the coronavirus patient, you will have the next day or the you have that day evening, you may have that is corona positive. No, it is very wrong. If you contact it today, it may takes the entire virus to inside the body and produce the symptoms. It is taking the duration 3 days minimum. 3 days back you have contacted, and today you may be with a positive. So this is very important. You have to understand. So why we are wearing the mask here? Nose, whatever the mask we use, that is a standard mask like N95, KN95. They are the mask which is without a valve. Don't put the valve, that is a valve present to the mask, that you should not wear. So without wall mask, N95 or double cloth thick cotton you can use, or surgical mask you can use, and that is which is preventing to enter the into the. Suppose this almost all, even you contact with the coronavirus person, he's throwing the viruses with his breathing and his coughing and sneezing. Through that, you if you wear the mask, that is a less chance of entering the viruses inside the body. And we require the viral load, means what? Specific amount of the viruses are required to enter in our body, then only we will be the affected by the corona. Otherwise, no. Even though you have come in contact, you have same home, remaining 4 people, one person positive, others all three are negative, or sometimes 2 people are positive, others two are negative, even though they are staying with them. This is there depends upon the immunity and the other part. So mask wearing, hand washing, and distance maintaining 6 feet. These are the very important to control the nowadays, prevent the coronavirus infection. So it is a related topic to nasopharynx effects first. If you take the steam inhalation, here only it will be killed and removed. And if you take the that is a hot or warm water in the throat, it may, before entering or piercing into the body, you have to take care this hot fermentation, hot inhalation, and hot warm lukewarm water and all. So this is all before the virus enters into the your blood. So that you have to know, because when it enters through the nose and it is in the pharynx, it on the wall of pharynx mucous membrane it is attached, and here it will go on multiplying. So before multiplying, we take the steam inhalation with that, and if you inhale through the mouth also steam, that may goes through the throat, and that may cause the, that is the reduction or reducing the intensity of the coronavirus. It is not the treatment or killing the virus, but it is a reduces the intensity of the that is affecting the mucous membrane. So these are the things you have to remember. Any inflammation of the pharynx we call as a pharyngitis. So usually nasopharynx, and we have oropharynx and laryngopharynx. Laryngitis may be there, or nasopharynx, or that is we have the rhinitis, sinusitis, and we have the pharyngitis, and even adenoids. So pathologically enlarged that is the nasopharyngeal tonsils, we call as an adenoid. Palatine tonsil, here in the throat, you have the throat pain. That time, maybe the sometime you have touched the material of the corona positive patient, and through that it is enters through the oral cavity, and sometimes it may enter through the oral cavity, and it is affecting tonsil, throat, and with the swallowing it enters to the stomach, causing diarrhea, dysentery, nausea, vomiting, dyspepsia, hyperacidity complaints. So they are very important hyperacidity complaint. Only nose only it is not entering. Second chance of entering the virus is through the oral cavity. It may enters through the GIT. If it enters affecting to the GIT, it may cause the hyperacidity symptoms like a heartburn, nausea, vomiting, feeling, and it may proceed into a diarrhea and dysentery and severe weakness. Severe weakness is a marked symptom of the coronavirus. So this is second route of entering the virus through the mouth, and the throat and in the esophagus to the GIT. This is all one which is. Then third one is which is where after this any root virus enters, it enters into the blood, and blood it is entered, and through the blood it is circulated and carried to the central nervous system, brain. So it is affecting the brain and other part. So it may affect the nerves of the smell and taste, and they may affect it, and they cause the loss of smell. Any person who is coronavirus positive and complains of the, that is a loss of smell, anosmia and osmia. And third one is loss of taste. They are affecting the cranial nerve which are supplied to the nose and tongue, and affecting the CNS. So one point I have told, through the nose entering, through the oral cavity entering, blood after entering into the blood, and once the positive patient, he may have the affection to the CNS that may be affected, and afterwards it may cause the many problems and all. So my dear students, first to diagnose the coronavirus, then it is very easy to cure. If you are go on neglecting the complaint and all, that time you may have the you may have the complaints and severe breathlessness and all. That is a late complications, and late if you go and admit, the response may be not there. Even though antiviral like Feviflu and we have Feviblu and all, Remdesivir, all these are injections which are given first till the ninth days. They are very active, Feviflu and all. They consist the antiviral effect. They are more effective first day to the ninth day. Ninth day afterwards, they are not useful. So remdesivir and other antiviral we can give. So this is all about the my pharmacology knowledge. Recently, I have completed my modern pharmacology course in the MBBS college, that is a Mirrors Medical College, Mirrors Government Mirrors Medical College. There, with that knowledge, I can share you very well about the present pandemic coronavirus and relating to the clinical anatomy of the that is the pharynx. So nasopharynx, oropharynx, you have to remember. And I have told the palatine tonsil throat pain may have patient which, and you have the again affecting to the trachea and lung, alveoli, and it may cause the breathlessness. So these all are the things you have to know. So in the applied anatomy, you have to write pharynx, that is a pharyngitis, nasopharyngeal tonsil enlargement, pathologically we call adenoids, tonsil, palatine tonsil, enlargement tonsillitis, enlarged palatine tonsil removed surgically, those we call as an tonsillectomy. Then difficulty in swallowing, that may call that is due to the, as it is a muscular wide muscular tube, and esophagus also wide that is narrow muscular tube. So that may cause into the, you have to remember about the almost all the that is a dysphagia. Dyspnea is the relating to the breathlessness, that is the difficulty in breathing, and dysphagia is the, that is one which is you should remember about the difficulty in swallowing. So these all you have to write in the clinical anatomy of the pharynx. So just you have to remember about the all these parts in the totally in the pharynx. I hope that I have covered the pharynx and other length you have to remember, and all these diagrams, origin, insertion point. This is one diagram for the 20 topics labeling which you can draw. Mandible, tongue, hyoid bone, thyroid, cricoid, larynx and pharynx, and esophagus, trachea, so hard palate, soft palate, tongue, palatine tonsil, nasopharynx, lateral wall of the nose, then auditory tube. You can draw this diagram as a one. Okay, so this is all about the which is you have to remember in the pharynx. I hope that you have understood the total pharynx. So next topic which is you want, please send me the topic to my personal WhatsApp number. then I will think of that, which is it weightage in the, more weightage in the, that is the paper, how much it is important. According to that, I will choose and I can take it. Okay. So whatever this was the topic suggested by the, I hope that LR, I hope. Yes. Sutar, you are there online. Vaibhavi,
Yes, sir.
you have suggested this one to revise.
Yes, sir.
Okay, are you understood? And in relation to
Yes.
coronavirus, I have to cover this all clinical anatomy and very basic and important nowadays. Okay, so any questions you have, please ask relating, even you want to discuss about the any questions relating coronavirus, please you can ask how it is possibilities, or think any questions you have, please you can ask. Unmute yourself and ask fast. So whatever this is all about the that is the pharynx. I have covered the first part, pharynx, all three parts: nasopharynx, oropharynx, laryngopharynx, introduction, boundaries of all these. Then I have covered the muscles, then a clinical anatomy. So please let us. I will answer for your questions, and any the topic you want to suggest now, you can suggest. I will think over that, and if don't suggest the topic, you are absent on online lecture, which is I may have the attendance on. So this is one which is you can remember. Yes. Anyone want to ask?
सर सर
Bola.
ते नेझोफॅरिंगचं लिहिताना बाउंड्रीज आणि फीचर्स हे एकत्र करायचे का सेपरेट लिहायचं सर?
नाही, एकत्रच लिहिलं तरी चालतं. बाउंड्रीज मध्येच ते कव्हर करत जातो आणि पॉइंट्स तेवढंच लिहायचं. जास्त आपण
ओके सर.
हे करत बदलायचं नाही. बाउंड्रीज अँड फीचर्स एकत्रच लिहिलं की ते कव्हर होत जातो. नुसता बाउंड्रीज लिहिला आणि त्याच्यात फीचर्स नाही लिहिला तर मग इम्पॉर्टंट तिथं पॉइंट्स मिस होऊ शकतात. त्यामुळे तुम्ही नेझोफॅरिंक्समध्ये सगळंच लिहायचं. ट्यूबल एलिव्हेशन, ट्यूबल ओपनिंग, and nasopharyngeal tonsil, tubal tonsil. All these you have to on the explanation of the nasopharynx with the boundaries you have to write it. Okay, is it clear?
ओके
Okay.
ओके सर, थँक्यू.
Then next, anyone wants to ask question? No question? Hardly we have few. I am taking attendance. You are looking at your attendance. Just yes, anyone wants to ask? Ask. Yes, anyone? Ask fast questions. Or next topic, which is you want, you can ask.
सर
बोला. नाव सांगा.
मुग्धा परचुरे.
हा, बोला.
सर वी वॉन्ट लॅरिंग्स मसल्स इंट्रिन्सिक अँड एक्स्ट्रिन्सिक
सगळं
मसल्स.
कव्हर केलेलं सगळंच लॅरिंग्स. ओके, लॅरिंग्स यू वॉन्ट.
येस सर.
लॅरिंग्स मध्ये काय तुम्हाला मसल्स पाहिजे का?
हां हां.
काय आहे त्याच्यात? थोडं ठीक आहे.
सर थोडं ट्रिकी आहे जरा ओरिजिन आणि इन्सर्शन.
काय नाही, तुम्हाला क्रिकॉइड कार्टिलेज आणि थायरॉइड कार्टिलेज कळलं नाही आणि त्याचं सुपिरियर कॉर्न्यू, इन्फिरियर कॉर्न्यू तुम्हाला माहीत नसेल तर मग ते थोडं ट्रिकी होतं. आणि आता एक्झाम आलेला आहे. ठीक आहे, लॅरिंग्स मी घेतो बुधवारी तुमचं टॉपिक सजेशन. ओके, व्हॉट इज युअर नेम?
मुग्धा परचुरे.
ओके ओके, ठीक आहे, घेतो. आणि काय
थँक्यू
क्वेश्चन?
सर.
ठीक आहे. एनिवन अदर? दुसऱ्यांनी काय झोपलं नाहीत ना? ऑनलाईन चालू करून ठेवून, स्क्रीन चालू करून जॉईन होऊन निवांत गाणं ऐकत झोपलं नाही ना? बोला फास्ट. So as per the Mugdha, I will going to complete the larynx in the next lecture. So relating anything you want to ask? Anyone suffered from corona in this batch? Yourself, anyone? Corona positive? No, no? Or anyone? So this is all I have covered the pharynx, and next any you want afterwards any topic anyone want to suggest, you can suggest. That is we can have the planning of that. So little bit which is I have knowing the uh, few points. Can you see these slides now? Larynx.
Yes, sir.
See, na? Okay. So just to revise once again introductory part of the larynx, because I have the time 5 minutes, I will complete. So larynx is one which is you have seen here, pharynx you have got. So whatever you have got about the position, location of the upper part trachea, we have the larynx. This larynx continues trachea, pharynx continues esophagus. That you should know about the completely. So larynx is an organ for the production of phonation, that is a voice. Whatever we talk, we speak, all these voice production is through the larynx. So one thing you should remember, the larynx is the organ for the phonation. Phonation is a which is we get as a word as a production of voice. So as you know, this larynx one, which is a very small in millimeters measuring organ, which is situated at the upper part of the that is a trachea. So when you see this is having the epiglottis, and we have the laryngeal cavity. So when you see the behind the larynx, we have the part which is we have just studied. This is we call as a laryngopharynx. So that you have to remember. So you have to know about the almost all these parts in the laryngopharynx. So this part which is you have to know, that is laryngopharynx, that is the one of the important part which is we have studied just now, and you can understand as this cavity which is you are going to get, it is bounded by the many paired and unpaired cartilages, and they are very important you are going to get. And when you see the anterior view and posterior view of the skeleton of the larynx, and this is the one question which is asked commonly, that is the name the that is named the cartilages of the larynx. So we have the totally, there are three paired and three unpaired cartilage. Three paired we are having on the posterior aspect, and three unpaired we are going to have the anterior aspect. So cricoid, thyroid, and epiglottic. So epiglottic, thyroid, and cricoid, they are the unpaired three cartilages of the larynx. Then we have the posterior aspect. On the thyroid cartilage, we have the three paired cartilages. We have the arytenoid, corniculate, and cuneiform. This is a cuneiform, corniculate, and this is a arytenoid. So these all are the three paired and three unpaired: cricoid, thyroid, epiglottic. These are the three unpaired cartilages, and three paired cartilages are those are the arytenoid, corniculate, and cuneiform. So this is very important. You have to know about the almost all the about the this larynx. So whatever the almost all muscles relates to the, you have to know, understand the thyroid cartilage and cricoid cartilage. These are the thyroid and cricoid and arytenoid, corniculate, and cuneiform. These cartilages, they are moved each other during the these cartilage attached by the joints, ligament, and muscles. They are attached. So you have to know about the Rutuja, unmute yourself. So whatever the you are going to have the totally three cartilages, you should know about this. And next you have to know about the, when you see on the lateral view, this is all about the, that is you are going to get the, this is thyroid and cricoid cartilages. This thyroid cartilage and cricoid you have to remember, and according to that the name muscle. Here on the posterior aspect we are going to get the arytenoid cartilage, and this is a cricoid, and this is a epiglottis. Epiglottis, arytenoid, and this is a cricoid that you have to remember. Then you have to know about anteriorly, we have the, this is thyroid cartilage, and this is a cricoid cartilage, and here we are going to get the arytenoid cartilage. So this is all you have to know, understand these diagrams, then only you can understand the origin insertion of all these. So this is very important of the total today's just introduction of the larynx. Larynx is the organ for the production of the voice, that is the phonation I have told. Then size you are going to get 33, and you are going to get 33 millimeters, that is you have, and you have 44 millimeters, and whatever the constitution of the larynx, it is consist of the all the which is you have the three paired unpaired cartilages. So three paired unpaired cartilages are, or skeleton of the, that is you have to remember about the skeleton of the that is a larynx. So it is made up of the three paired unpaired cartilages, and they are moved and attached by the many muscles and fascias, and that is we call as those are the laryngeal muscles, and those movement of these cartilages done by the many ligaments attached to this. So that you can remember about the almost all the, so almost all the you can remember about the cartilages of the larynx. So it is a brief introduction. Laryngeal joints are there. That is the cricothyroid, cricoarytenoid. So this is a cricoid and thyroid. This is the inferior cornea of thyroid and superior lamina of the cricoid. That is a cricothyroid, and cricoarytenoid, this is a cricoid cartilage, and this is the base of the arytenoid cartilage, cricoarytenoid joint. And fascia, ligaments, muscles, they are attached to all these cartilages, and they are moved during the different production of the voice. So that is your, this is all about the total first introductory part of the you have to know about the introductory part of the all this. Okay, so I hope that this is all I have covered now. Only 3 minutes are remaining. So muscles of the larynx I am going to explain in the next lecture. So I hope that is you understood the almost all about the, that is the introductory part. So you have to remember in the introduction, the heads I have given here: introduction, situation and extent, size, constitution of larynx, the laryngeal, you have to explain about the laryngeal, that is the laryngeal joints, and next you have to remember about the, that is the blood supply, nerve supply of the total laryngeal muscle, and clinical anatomy that I am going to cover. So I hope that is you have understood this about the introduction. So be study before Wednesday what are the cartilages, how they are, which is thyroid, cricoid, and epiglottis. With that, you have to understand the all origin insertion. This is a thyroid cartilage, cricoid cartilage, how the, what is the superior cornu, inferior cornu, what is superior lamina, inferior lamina, you have to understand. Posterior view, epiglottis, arytenoid cartilage, this, and this is a cricoid cartilage. This you will understand means If I tell posterior surface of cricoid cartilage, if you know this is a cricoid cartilage and this is a posterior surface and muscles are arising, that you can understand. So this is all about the just brief introduction of the larynx, and very important, this is comes for the almost all the about the 10 marks question, and you have to know about the almost all 10 marks question, and very tricky as Mugdha told, that is the they are very small muscles and origin insertion of that. Big bone surfaces attachments muscles we are unable to remember, and very small part which is arising origin insertion, that is a very this one. So out of 9 muscles, you should able to write properly about to 6 to 7 muscle. It's okay, but you have to write properly origin and insertion. So this is all muscles of intrinsic muscles of the larynx I will cover in the next lecture. So I hope that you have understood the introduction. Briefly, I will cover again introduction in the next lecture and going to the directly to the muscles. So be study and make it perfect all the 9 muscles, intrinsic muscles of the larynx. So I am going to cover that in the next lecture. I hope that you have understood. Anyone suggest 1 minute is remaining, anytime it may close. So till that, anyone wants to suggest me any topic, you can talk with me. Anyone? And 1 minute is remaining. Anytime we may close the things. So anyone you want to tell, suggest, or you can be prepared to answer or tell me in the next lecture also. I hope that you have understood. Okay. So with this, I am completing pharynx and introduction of the larynx and intrinsic of larynx in the next lecture I am covering. So with this, today's lecture, all this covers about the larynx and pharynx. Important, that is the topic.